Hi, my name is Lulu He, and for this SSR Bite Lecture series, I'm going to show you tips to overcome what I think is the 3 most common challenges with ultrasound-guided procedures. In my experience, the 3 most common challenges in ultrasound-guided procedure for any new user is initial needle localization, incomplete visualization of the entire needle, and difficulty achieving the perfect placement or off-target needle position. Most proceduralists overcome these challenges with experience and gradual development of hand-eye coordination. But I have some tips that may help you achieve success quickly with minimal patient suffering. In the next 5 minutes, I'm going to show you 4 video demos of how I troubleshoot these challenges. Let's go to the first one. Initial needle localization. The first thing I tell trainees is to select a good needle entry position. For me, that's around 1 centimeter away from the edge of the probe. If you start out too far, you're already in for a challenge. Secondly, when the needle is just deep to the skin, flatten the needle length so that it's almost flush with the skin surface. This allows the maximum amount of echo to reflect on the needle, and therefore maximizing the chances of visualization. Once the needle is seen, the needle angle can be adjusted and readjusted under ultrasound guidance. Advancing the target should be otherwise simple. Next, if you still cannot visualize your needle, try this foolproof trick. After initial entry into the skin, the needle should be shallow and relatively flush to the skin. Place your ultrasound probe directly on the exposed portion of the needle, line up the ultrasound midline marker with the needle, and gently slide down onto the skin. The needle should be immediately visible. The second most common challenge that I see day to day is incomplete visualization of the needle and erroneously identifying a fake needle tip. The cut-off portion of the needle can mimic the needle tip. This is due to the ultrasound probe slightly oblique to the length of the needle. To remedy this, you will need to rotate the probe over the needle. I'm over-exaggerating this motion here in the demo. First, place a visualized portion of the needle in the center of the screen, and slowly rotate the probe until the probe and needle are aligned. Scan distally to see the tip. You can also gently manipulate the needle to show motion at the tip. Off-target needle position. Despite careful planning, some targets are hard to reach, and some areas of the body are difficult for probe stabilization. The steps in the following demo can be used to correct most instances. Never do what I'm about to do on a real patient. I'm going to blindly stick the needle in at an oblique angle without ultrasound guidance. Once I localize the needle, I see that it is some distance away from the target, and the needle tip is closer to me, while the target is farther away. Withdraw the needle to just below the skin surface using ultrasound guidance. Slide the probe back to the target, put it in the center of the screen. Look down at the probe and the angle external portion of the needle so that it is pointing to the probe. Slowly advance under ultrasound guidance. Repeat the process as needed until you are satisfied with the positioning. Pull back, look, realign, advance. In summary, consider these tips when performing ultrasound-guided procedures, especially if you are learning. Hand-eye coordination can be developed with practice. Try to learn from your successes and mistakes after every procedure. Ask yourself, what went well? What would you change next time? And develop your own tips and tricks and share your insight with others. If you would like to practice on your own and not with a real patient, here is my phantom recipe. My phantom is made from agar gelatin, which is a plant-based gelatin you can buy directly from Amazon. First, I make the skin layer by mixing a thin layer of liquid agar with an opaque substance, such as a protein drink. After the skin layer is set, I pour a second layer of agar. When the second layer of agar is semi-solid, around 20 minutes after it comes off of the stove, I place targets at different depths. For example, I use blueberries or beans in these demos. You can also use whatever you have laying in the kitchen. After about 4 hours at room temperature or in the refrigerator, your Phantom should be ready. Simply flip it over and enjoy. The Phantom is stable at room temperature, and it can be reused if you refrigerate it. Thank you for watching my SSR Bite lecture. You can see additional lectures by the SSR on the SSR YouTube channel using the QR code below.